Welcome to our after-show conversations where we take a closer look at the people and organisations behind the stories we share on this podcast. Today, we're following up on episode 7, which focused on Johnson & Johnson's work to protect patients from fake or stolen medicines, especially in places where regulations don't yet require traceability. For this bonus episode, I'm really glad to be joined by Blair Korman, who is Senior Director, Digital Identification and Traceability at Johnson & Johnson Supply Chain, and who's been closely involved in making this work happen. We'll talk about some of the real-world challenges, how GS1 standards support this approach, and the impact it's already having on the ground. Blair, let's maybe start with a quick introduction. Can you tell us a bit about your role at Johnson & Johnson and how it connects to product traceability and patient safety?
I sure can. So it's great to be here today. I lead the digital identification and traceability team at J&J. But I focus on delivering essential capabilities related to regulatory and customer compliance. My role involves integrating our GS1 standards with emerging digital technologies to enhance product traceability. We like to say that we work to unite the digital thread with our physical product, and that ensures access to accurate and timely product data for our patients and customers, which ultimately strengthens our commitment to the safety of our products as they move through the supply chain.
Thank you. Back in episode 7, we talked about how Johnson & Johnson is using serialization even in countries where it's not legally required. What motivated the team to take that extra step and go beyond compliance?
Sure, that's a great question. So at J&J, we're committed to ensuring that integrity and safety of our product that I talked about as it moves through the supply chain. And one of the ways that we can do that is leveraging our existing, which are very comprehensive and seasoned serialization programs around the world to help combat the illicit trade and counterfeit medicines that affect many countries that don't already have or don't have yet regulations around serialization and traceability. So we actively work with our brand protection associates in each of our regions to identify vulnerable products and extend that serialization practice to non-regulated countries.
And for listeners who might not realise how serious this issue is, what risks do fake or stolen medicines actually pose for patients? Why does it matter so much?
In the end, it matters to all of us. So counterfeit or illegally diverted medicines pose significant risks to patients, including ineffective treatments, harmful side effects, and unfortunately, even life-threatening consequences. So those counterfeit products can undermine that trust that we all have in our healthcare systems and lead to serious health complications. It matters greatly for patient safety as our top priority. And we must ensure that these individuals, including ourselves as patients, receive genuine, safe medicines to protect the health and well-being of our society.
Rolling out a program like this across different countries sounds like a huge effort. What were some of the practical or operational challenges you faced, especially in places with less infrastructure?
So I think having a long history of the serialization program certainly helps us move forward in unregulated markets and leverage what we've already created. We reduce challenges in implementing in these markets by leveraging that existing serialization and traceability program, which includes processes, equipment, and systems that are all built on GS1 standards. We have been doing this for a while, and since our production lines already integrate serialization capabilities, we can activate those features for high-risk products in using simple and efficient processes. This activation significantly improves that visibility as product moves across the supply chain. And the lift is, albeit required coordination within our internal supply chain to activate to a new market. We've proven that we can do it time and time again. So we'd like to be able to leverage that existing experience to turn on our new markets, even when it's not regulated.
As you just mentioned, GS1 standards play a key role in the solution. How have they helped J&J strengthen traceability and support your frontline partners?
Yeah, that's a great question too, because this is why we're here. So without the GS1 standards, we wouldn't have that standard language of talking to our customers, our patients, and our other um, trade partners throughout the supply chain. So they play a vital role. So GS1 standards play a vital role in improving that end-to-end traceability for our whole industry. Johnson& Johnson is actively engaged in this effort. We're happy to share our success stories. We're happy to share our challenges so that others can leverage the standards as well, because they do establish a common framework for identifying and tracking product throughout the supply chain. We enable our partners to know what is in a barcode and be able to read it and attach it to the data that is also shared and sent, so that as that product moves through the supply chain, the integrity allows us to all respond swiftly to any issues that may arise with product safety and making sure that those products stay safe for our patients.
Since launching the programme, what kind of feedback have you received, whether from local teams, healthcare workers, or other partners?
So since launching the program, we have received positive feedback. Proactively serializing the medicines has enabled J&J to form meaningful collaborations to address global challenges and introduce essential technologies where needed. A key aspect is the enhanced verification capabilities for some global health agencies. So if you think about when a healthcare worker or customs official scans a medicine's barcode, it activates a security layer that verifies the product's information against its digital identity. So if issues arise during that actual scan, such as a product's expired or is a mismatched serial number, an alert is issued to investigate the product's authenticity. So that overall feedback indicates that serialization effectively protects product integrity and safety for patients. It allows us another layer of security for those products as they move in the supply chain.
To your knowledge, Blair, has this work inspired interest or similar initiatives in other regions or organisations?
So GS1's publication of the case study promotes our work. It showcases the advancements and serving as a resource for others. So sharing is good. This initiative not only enhances our product tracking capabilities, but also reinforces our commitment to safety and quality, and hopefully encouraging industry-wide adoption of best practices. Within J&J, we strategically employ serialization where it provides significant benefits. What started with a single product back in the day when we implemented the first line labeling changes and sharing of data, it has now grown to include, many products, showcasing our ongoing initiatives. We continue to explore this collaborative opportunity. In the end, patients and customers are using all products within the healthcare industry. And if one example at J&J can inspire others to do this sort of adoption, we've helped that common patient that we all have.
We have a very broad audience here on Scan Stories, not just people in healthcare, so for those outside the industry. What's one thing you hope they remember from this great story?
So there's value beyond compliance. I think sometimes when we implement a program like serialization, we tend to think we must do it because it's required, but keep the true meaning of the regulation and the true reason that health authorities have asked for it in mind, and look for that value beyond compliance. Work to identify specifically those vulnerable markets and products, but you can't do it without collaboration. So we have large organizations, large global organizations. So collaboration is always key. Listen to the voices of the folks that are in those markets, working directly with the customers and patients and monitoring product safety at the local level, and use those enterprise global capabilities to help them.
Blair, thanks again for taking the time to walk us through this. It's inspiring to see how global standards and forward-thinking approaches can make such a meaningful impact, especially when patient safety is on the line.
Thank you. It was great to be here.
If you haven't already, be sure to listen to the main episode. It's episode 7 in your feed, And it's called How Johnson & Johnson Uses GS1 Global Standards to Tackle Counterfeit Medicines, and as always, feel free to share it with your network. As usual, until next time, let's keep scanning for solutions that make a difference.